Welcome to Beauty Unveiled. I'm Dr. Angela Sturm. I'm a double board certified facial plastic surgeon in Houston, Texas. Here we are going to talk about how things work with facial plastic surgery and answer any of the questions that you have but don't know who to ask. So today we're going to ask, does Ozempic or the GLP1 medications change your surgical technique or outcomes with facelift? And I really enjoy doing facelifts on people who have lost a significant amount of weight because it's such a great process and becoming your best self and becoming healthier, and I get to be a part of that process and really get to let them see themselves in the mirror when they may not have been able to see that for a while. Ozempic and GLP1s have been an amazing way for people to manage their weight, to control their diabetes, to reduce high blood pressure, just overall become healthier, which for me makes you a better surgical candidate because you're in a healthier place. The anesthetic is going to be easier. You're going to recover better. And so it's great if that's something that you think that you might do, to do that first before you pursue any surgery. It also makes you a better surgical candidate because you are at that plateau weight before we do surgery. So I'm not as concerned, of is your weight going to go up or is it going to go down? Is it going to change our results? And so it's something that can help maintain not just your weight, but also your result. Sometimes whenever we do lose a significant amount of weight, it can change the elasticity of your skin. And so it may not be as elastic to tighten back up as much as we would like. And there are times where I tighten as much as I can, but if there's a little bit more relaxing in that after the surgery, there's little tuck-ups or non-surgical treatments we can do to get the best result possible. And just knowing that that's the case and having experience with that is possible, then we plan ahead for that. I think it's more whenever you're not aware of these things that can happen, that if I tell you ahead, then we have a plan. If I tell you afterwards, it sounds like an excuse. And I totally agree with that. I want to be a part of your process to help you win. I would not say that the actual technique is different. I would say that I am a little bit more aggressive with the tightening and the lifting because I know it will relax somewhat. If I'm doing fat transfer with the facelift, I will be a little bit more on the conservative side because the fat has changed a bit, and I want to make sure that what I transfer is going to look good no matter what little fluctuations there are, no matter what changes there are in life. If we're on the younger side, if you haven't gone through like menopause, what's that going to do and how that's going to change? Because the thing with fat is you can always add more. But once it's there, it's really hard to take out. It's not like something that you can go in and take the little fat out. You can try to lipo, it doesn't work great. So I rather do more of a staged approach to that sort of thing and get you to the result that you really love, and it gives you that like healthy, youthful glow. And so I would not say that the techniques so much are different, but it's just adjusting for the whole process and how these tissues respond and knowing how this works. I think you can have an amazing result, a really, really amazing result. I've had people that have had facelifts years ago and then got on a GLP because it became available and lost a significant amount of weight. What they have now is way better. You're like, well, if we could have done this before the first one, but it wasn't available. You can get this just incredible jawline, amazing neck, because you can really, really see that bone structure to really get that very nice. So let me know if you have questions about weight loss and facelifts or anything facial plastic surgery. And you can find me at www.drangelasturm.com and come in for a consult.